Welcome to our introduction to the new standards in cultural linguistic competency and implicit bias in continuing medical education. Our agenda for this webinar today is to give you an overview and background, go through CMA's process, get to the definitions and standards themselves, and then show you the toolkit we have available on our website. A little about CMA. We are the ACCME recognized accreditor for the state of California, with over 200 provider organizations, including some in Alaska, Nevada, and Oregon. CMA was delegated the authority to create these standards for all California providers, both those accredited by CMA and ACCME by the Medical Board of California. Getting into the law itself, Business and Professions Code 2190.1 is codified from AB 1195, which required the inclusion of cultural linguistic competency in continuing medical education as of 2006, and AB 241, which requires the inclusion of implicit bias as of January 1st of 2022. Before we get into the definitions and standards, I wanted to get to a few frequently asked questions, which were the most frequently asked during our public comment process. The standards apply to all CME activities with limited exception as defined by the law, and we'll get to that a little bit later. All CME providers located in California, whether you're accredited by CMA or ACCME, are required to comply with the standard. And adherence with this law is separate from your accreditation decision, but you will be required as part of your initial accreditation, reaccreditation, and during the annual reporting process to attest to the ACCME CME program business management procedures policy, which states that you are adhering with state law. We are fortunate to have assembled an advisory council of CME and health equity experts listed here. The council met from August of last year through the release of the final standards. The advisory council meetings reviewed current standards, learned the importance of accredited CME, discussed literature reviews, as well as results from the flash survey and interviews with CME professionals and patients. We also want to note that we have been working closely in collaboration with ACCME while developing these standards, and they have reviewed all materials prior to public release. The intent of the legislation and incorporating cultural linguistic competency and implicit bias into CME activities is to ensure that physicians in California are trained to treat their patients in a culturally competent manner and to have awareness around their own biases and how bias in general affects patient care and outcomes. The ultimate goal is to increase health equity and improve patient outcomes. With this in mind, the guiding principles for our advisory council were to follow statutory intent and language, to draft standards that matter, to draft standards that are achievable by all CME programs, whether you're large, small, rural, urban, hospital, society, etc., to collaborate with our provider organizations to support implementation, and to secure feedback from our stakeholders, which was during our public comment period that was held in the spring of 2021. The Advisory Council worked to create definitions of cultural linguistic competency and implicit bias for the purpose of creating these standards. These definitions are intended to provide additional context to the definitions presented in the controlling statute, and they're available in full on the CMA website. From these definitions, we drafted the standards themselves. They were designed to interweave cultural linguistic competency and implicit bias into CME activities at the start of the planning process. They are geared towards giving the planners, faculty, and speakers the framework they need to incorporate cultural linguistic competency and implicit bias into activities in the way that best works for the content itself. We purposefully did not include specific requirements such as objectives in order to allow programs to individually determine how to best include this content, although objectives are certainly one way to do so. Standard 1, to provide a website link or other means to make AB 1195 and AB 241 legislation accessible to planners, faculty, and speakers. And just to note that this link is available on the CMA website. Standard 2, to present the definition of cultural linguistic competency and implicit bias to planners, faculty, and speakers. Standard 3, to direct or otherwise make cultural linguistic competency and implicit bias educational resources available to planners, faculty, and speakers. And we are in the process of collecting a library of these on the CMA website to make your lives a little easier. Standard 4, to reflect on the patient populations impacted by the provider's CME program to best determine how cultural linguistic factors should be addressed and communicate that to planners, faculty, and speakers. Standard 5, to reflect on disparities in care affecting patient populations impacted by your program and the role that implicit bias plays in these or may play in these disparities, and communicate that to planners, faculty, and speakers. Standard 6, to include diverse planners, faculty, and or patient representatives in the activity planning process. Standard 7, to incorporate educational components to address factors as identified as impacting your patient population and disparities potentially caused or exacerbated. And just a note that if your activity is exempted from including cultural linguistic competency and implicit bias content by the state law, that must be documented as well. Just a note, we have also developed best practices at both the activity and program organizational level. They're not required for compliance with the law, but they're provided as examples of how you can meet the law and excel in this space. The best practices are available on the CMA website, and we highly encourage all providers to keep them in consideration. Getting into our toolkit, this is a screenshot of our new CME webpage. To support providers' implementation of the new standards, we've created a toolkit and resources. These were created in collaboration with ACCME and key stakeholders. This is a living page, and we will be gathering more information and adding to it as we get it. We've summarized the standards in this reference chart, which provides a quick overview of the standards and rationale for each of them. To provide greater clarity and understanding, a fact sheet has been developed for each of the standards. This includes the purpose of the standard, tips for application, additional support and resources, and note that with the fact sheets for standards 4 and 5, they are combined. Standard 4 is specific to cultural linguistic competency, and standard 5 is specific to implicit bias. Though together, they are focused on incorporating real-world scenarios into education. To support implementation, we have addressed frequently asked questions that you may have or may receive. I went through a few of them earlier, but there is a much more robust document available on our website with these questions taken directly from the public comment process. We hope this will address nuanced questions and help you to speak to the importance of this legislation. Note that if there are questions that are not addressed that you feel would be beneficial for everyone, please email us at cme@cmadocs.org. We've also developed an activity planning worksheet. Within this, you'll find checks and questions to help clarify that the standards have been met and included in your planning. Just to note that this is not meant for submission to CMA, but it's meant as a helpful resource for CME planners. Our CME Cultural Linguistic Competency and Implicit Bias website is a wealth of information and resources. You'll find information discussed today, including the standards and best practices, tools for implementation, additional resources, background on state law, and of course, contact information with CMA staff. We will be continually updating the website, so keep an eye out for changes. And finally, getting into the exemptions. Business and Professions Code 2190.1 allows for exemption to the law in the case that CME is dedicated solely to research or other issues that do not include a direct patient care component. We encourage CME providers to take a broad view when determining the relevance of cultural linguistic competency and implicit bias material. It's not always immediately obvious. However, we encourage you to think critically to determine whether the information can provide additional benefits to your learners. And just a reminder that if you do determine that your CME activity falls within this exemption, that must be documented as well. Thank you for joining us for this webinar. We hope you found it helpful. Please visit our website at cmadocs.org/CME to explore all of the resources that we went through on this webinar and look through all of the rest of the resources that we did not have time to get to today. And just a reminder, it is a living page, and if you would like to submit anything or have any suggestions, please contact us at cme@cmadocs.org. Thank you.